Thank you so much, and I'm absolutely delighted to be here because we wouldn't exist if it wasn't for the people in the room here today, because 20 years ago, a certain Andrea came over to the North East on our very first conference for a case for a smoke-free North East, and she really inspired people in terms of the private members bill and that sense of locally together. And, you know, the North arguably has the most to gain or lose from some of the decisions that are made nationally as such. So I did just want to pay credit, actually, because it was because of the momentum that you were building over here. So thank you so much. So what I'm going to quickly do in my quick whistle stop is go the right way. Oh, there you go the right way for a start. It's just to give you a really quick overview. So we've been running for 20 years now. We're actually within the NHS. We're not a charity, people think we are. We're a programme actually that's been hosted successfully within the NHS. But hopefully you'll get a sense of what you can do when you're given the autonomy and you've got, you know, that mandate as such to have a very strong vision. I am the Director of Balance as well, so I'd be very happy to come back on a future occasion if you do want to talk about alcohol as such. But it is about, you know, a snapshot of the approach that we've taken, and I'm really delighted that I'll be followed by Deborah as Chief Executive of ASH, because I think advocacy is not a dirty word. It's advocating on behalf of our loved ones, our communities. It's having a very clear evidence base, but advocacy has been pivotal to what we've done. And Andrea asked me to particularly shine a light on the role of media and communications. So a huge thanks, and thank you to Davey and to Maggie and for you showing that film at the beginning, because it is about, you know, it's about real people, isn't it, ultimately? And then at the end, just a little bit about the importance of the P's, and I was trying to summarise really my reflections, having been the director from the very beginning, what I've learnt along this journey as such. So the approach taken, I mean, we're really lucky in public health. This is such a hugely strong evidence base. You know, all credit to the Royal College of Physicians going back to 1962 with a blueprint for what needs to happen, and they were really spot on, actually. So we've known for a long time what needs to happen, but sadly it did take quite a while before we really gained that momentum. It wasn't arguably until, I'm sure Deborah will cover this, in the late 1990s, and, you know, I really hope that we don't sit on evidence base that long for other topic areas. But essentially it is about international to local level, you know, global tobacco companies, and it is about recognising that the more we can collaborate across the world on these areas, the importance of it, because and I think this is where, you know, the leadership of Cheshire and Merseyside, that locally together approach, that recognition of building up further momentum about regional and the links international and then international. Population level working, so that what the tobacco companies would like you to do is just simply target individuals and say it's about individual choice, it's about you've made the wrong decisions, or, you know, freedom to choose as such. And this is about shaping that population level, making tobacco use, the industry, arguably less affordable, attractive, accessible, and it is about shifting the social norms. And I think that's what we were very clear on in the North East. It was about, you know, I came from Australia back to the North East. There was a fatalism, I will say, in the North East. It was almost like, well, we'll always be the worst place, we'll always have the highest lung cancer rates. And I actually challenged that, and I said it doesn't need to be like that. So it is about those societal norms, and I think we have seen a huge shift over the last 2 decades across Northwest, Northeast England, UK generally. And it is about partnership and collaboration is key. So I think that's just testament to everybody in the room today. This is everyone's business. There isn't one small tiny team that can ultimately end smoking. Everybody has a role to play, and everybody's role is equally important, whether you're from the fire service, whether you're from the voluntary sector, whether from NHS, from local government, from academia. It is that sense of that level of collaboration. And I think the unity, because there is no other known product out there, is there, that is absolutely manufactured and guaranteed to hook when young and kill 2 and 3. So that's been important to us. A clear vision along the way, a sense of, you know, we've been laughed at quite often, but I've always been really clear that we are going to end smoke, and one day we will see an end to all of this. It had a beginning, it's had a middle, it has got an end. The question for us in the room today is, how long do we want it to take for the end? And I think all credit to the Department of Health, Rebecca's speech, because we are in a unique, momentous opportunity at the moment. And the more we say this vision is the right vision, I think the more likely it is to happen. So, I'm getting really old now, and I'm really look forward to the day when we don't need fresh, because I think it is really vital that we should be saying we will end smoking. And that sense of distributed leadership, and just brilliant that the speakers in the room today, and that sense of multiple messengers, but everybody saying the same messages. So we've had the very same recipe for 20 years. It's our 8 key strands, which are very, very similar to the brilliant Empower framework that you're hoping to adopt here. And it is about saying you need to be comprehensive. All of these things come together synergistically. And I think what's very important, Andrea and I will absolutely know this. When we had the groundbreaking smoke-free legislation that was introduced in 2007, the number of people who said, oh, so is that it now? We don't really need fresh anymore, or we don't need whoever anymore, job's done. That was a really important milestone, but there isn't a magic solution to all of this. And you do need to keep going. So all of these strands working together. And I think at the top here, our number one has always been about building infrastructure, skills, capacity, partnership working, and the role of tobacco alliances, etc. And I think that's been really important, that we've built up that momentum and people understanding on the evidence base. The second one is around advocacy. So advocacy for evidence-based policy. I'll explain a little bit more for that. Third one is reducing exposure to second-hand smoke, and the job absolutely isn't done there. We still do have too many people who sadly are being exposed, particularly in the homes. So it was really good Sarah mentioned, the vital role we all have to target, particularly social housing as such, and a key role for the NHS, I think, to be doing a lot more around that. Number 4 is around media communications, and I will definitely speak a lot more about that, because I think that has been at the cornerstone of what we have done, and that's down to the ongoing commitment of our funders, that we've been able to do mass media campaigns in the absence until very recently, certainly for the last 10 years, of anything happening nationally, and that's been, I think, a really important USP for us. The 5th one is around supporting smokers to stop and stay stopped, and that was excellent from Sarah, just to reiterate the really strong evidence base for that. But what we've done is a lot of reframing in terms of for our fantastic NHS partners in the North East, is to not view smoking as a behavioural choice or an unhealthy behaviour, but actually it's a chronic relapsing long-term condition, and that's the importance of treating tobacco dependency within that setting. But then it's brilliant, the opportunity our local authorities now have in terms of the additional funding for stop smoking support locally. And I think what's vitally important is what we're doing is triggering quit attempts at population level. And not everybody is going to want to or need to come through your service, but the services have got a very important role to play in terms of that individual, to give them the best chance to quit. The 5th one is around reducing price and illegal tobacco, and I'm really pleased we've had the support from Kate Pike here from Trading Standards Northwest for what also feels like forever, in the sense of this collaborative approach across the north of England, because price is still very, very pivotal in terms of getting new smokers in, particularly children and people selling to them. And so I think we need to absolutely keep the downward pressure on reducing supply and demand for illegal tobacco. The 7th one is around tobacco and nicotine regulation, and this has been a lot of the advocacy in terms of things like standardised packaging, etc. And I think what's really important as well is that we recognise where the most harm comes from. It is from combustible tobacco products. So as we think into the future, it's making sure that we're not taking our eye off the fact it's the cigarette, which is arguably is a very, very effective weapon of mass destruction, isn't it? Guaranteed to kill 2 and 3. And the 8th one is around research, data, monitoring, evaluation. And I think very important for us every single year, and again through the amazing collaboration of ASH, is we can track public support, and we can absolutely see now how cross-party the support is, and the public really get this. So that's been important to do. And some things you need to just keep doing. The number of times people are, you're not going to change your 8 key strands. No. because they work. But one key message for me today is flexibility. So we weren't quite anticipating such a comprehensive tobacco bill and the smoke-free generation. It's really important. That is the thing that's absolutely we're focused upon at the moment. So you can have a plan, but it needs to have flexibility written in so you can drop things and just really maximise other opportunities. And just principles, so leading from the experts, and we put this up because people chuckle, but it's not that long ago that, you know, we did see adverts like this and how clever the industry was, particularly in the early days, around positioning doctors, because of course doctors are very well respected, and if a doctor's smoking, must be okay. But this was a clear advertising campaign, which was doctors smoke Camel more than any other cigarette, and it was about the fact that if you smoke Camel, it would soothe the back of your throat, etc. We chuckle at that. But particularly in the northeast and in our working class areas, Lambert and Butler in particular did a brilliant job, kind of like this camaraderie and blokes and reg and all of this. But interestingly, two middle-aged blokes in this advert, but look at the industry, what health warning they picked for that packet, which was smoking when pregnant harms your baby, which is just quite ironic with that imagery. This one over to the right is actually from Germany, but it's quite a recent advert, which has much fewer restrictions than we have here in the UK, and it's about rebelliousness, it's about still attractiveness and things. So what we've been doing is countermeasures. So we've been doing, we've been very clear on the evidence base and working with colleagues internationally. And it's about, the one key message I would say to you today is likability of an advert does not mean it's going to work. So we do huge amounts of qual insight and testing, etc. And the key thing is you need to elicit negative emotions. You need to elicit a level of feeling really uncomfortable, but so that it makes somebody feel really uncomfortable, but very, very importantly, hope. And the role of case studies, the role of the support, great support that you've got here in Cheshire and Merseyside. But when you hear people say, oh, scare tactics don't work, actually there's a very solid evidence base for the bringing to life the negative health harm aspects of smoking. And nowadays people are very used to graphic imagery, aren't they? And they're very used to guts and gore on TV adverts and things. And we actually find when we're doing a lot of work with people who smoke now, they really say, give us the truth, hammer it home, don't underplay it. Because when people say all smokers know how harmful it is, it's not actually true. They will dismiss it. You will disconnect. And it's the fact it's 2 and 3, and that is really still a huge amount of way to go in terms of that recognition. So just some of the campaigns over the years. This was COPD is a disease where your lungs are destroyed. It was called the Every Breath campaign. We were really lucky because he's a Geordie boy, but Sting came on board with us for that and let us use his lyrics. This is in the middle here. This we and then we buddied up with Andrew and team. But this was the world's first smoking and COVID TV advert that we actually, within a couple of months of the pandemic hitting, we just had a hunch we needed to do something on smoking. So this is Ruth Hussey, who is our ICS clinical lead for tobacco. She is amazing. And, you know, she just helped us out with that. This is Don't Be the One. This was around the 1 and 2 at the time, dying from smoking. This is buddying up with the Scottish Government, which was around second-hand smoke in the home. This is the work that we've done around illegal tobacco through the Keep It Out campaign. You've met Maggie. This is, you know, the really important thing about amplifying national campaigns like Stoptober. And this is, we'll talk about our Smoking Survivors campaign. This is the phenomenal Kathy, who 2 days before her 50th birthday, sadly was diagnosed with lung cancer. And the power of real people. And Kathy this morning actually, have I got time? Really quick. 30 seconds. A little film being made this morning with a lady. We run Facebook, and this is really important. We live and breathe it. I monitor it all weekend. I chat to people on it. But a lady popped up on Facebook about 3 months ago and said, oh my God, I saw that TV advert. It shocked the living daylights out of me. I thought that could be me. And I got in touch with her and I said, can we meet you? And she said, oh yes. And she said it was the most perfect timing because she saw the TV advert. She really identified with Kathy. This lady's also called Kath. But the very next day, she got a text. She's a social housing tenant, so from Gen 2. who said, if you're a smoker, we're here to support, we've got free vapes. So it was just the most perfect kind of, she saw the TV advert, could be her, and then she's been supported to quit through the Stop Smoking service and our housing provider. So we're filming when Kathy meets Kath this morning, and I really hope it's going to be quite a powerful little advert. So these cornerstones, media and communication at the heart of what we've been doing. And it's not just about individual behaviour change, but it's also about building support for a smoke-free future. And I think these campaigns at the moment are really important to be running alongside the passage of the tobacco bill, because the campaigns also reach our decision makers, they reach our MPs, etc. And I think the CMO's been doing a very excellent job at the moment to keep reinforcing the scale of harm of tobacco smoking, the 16 cancers, the COPD, the diabetes, the dementia. And he is worried, I think, because there are some MPs that possibly have never met anybody who actually has smoked, has got addicted, has suffered from smoking-related illness. So I think the more you can bring to life the gravity of this, I think it's very important we do that. And it's not just being on TV, it's the year-round PR I'm sure you will be doing here as well. It's that responsiveness to the media, it's keeping this in the public eye, it's adapting to the media landscape, which has changed hugely over the last 20 years for us. So, we do our utmost to keep abreast of that. But in terms of our key target audience, terrestrial telly is really important to be on there, in addition with paid for, etc. as well. But it is about, it's not just about behaviour, but it's the impact, it's the action, and it's increasingly, it's not just a health issue, is it? This is about economic impact. It's about, for a thriving business and workplaces, we need to keep people well. We can't have people going off, sadly in their 40s and 50s from smoking-related harms as such. So we try to talk about the impact across our communities. And it's, 2.5 billion per year. I can't remember the costs for Champs, but it'll be very, very high up there. And it's business that bears the brunt of it. It's not health, it's not social care, it's actually your employers that really have that economic impact. So we already know this is a pivotal moment in time because of the announcement in terms of the smoke-free generation policy. So I did just really quickly want to play. This is Sue Mountain. I can't thank Sue enough. She's been on this journey with us for 4 years now. She's brilliant. She's from South Shields. She's helped Ash out a number of times with the All Party Parliamentary Group on Smoking or Health. I genuinely don't think we would be quite where we are had we not had Sue constantly. Whoever minister it's been, she's spoken with them. So her TV advert is now the one that is being used nationally. So a huge thanks to the DH.
I literally would wake up one eye open and then need the cigarette. I was so addicted. My kids' reaction with that was they thought they were going to lose their mum. What's hot? Idiot. I lived with a tube up my nose, down my throat and into my tummy. Smoking tried to take my life and my health, but now I've got my life back. Keep trying. You've got to keep trying to quit. It's worth it.
Make a fresh quit at freshquit.co.uk.
So there's a version of that advert that's been on air nationally, and it's going to be on air again over the next few weeks, which is just brilliant to see. So, I'm basically thrilled to be here because I think the locally together approach that you're discussing absolutely is the right thing to do. We really want to work alongside you. We've got lots that we can learn from the fantastic work that I absolutely know has been happening across Cheshire and Mersey throughout all of the years. But I did just want to quickly pick up on a few personal reflections in terms of the P's. And when we talk about the P's, we think of the importance absolutely of policy measures like price and promotion and packaging and place. But a night before a conference we had in September, I invented some new P's, and I was saying to Andrew, I can't remember what half of them stood for, but I'll give it a go. I've got advocacy. I won't talk about advocacy. I'll leave that to Deborah. But advocacy at the heart of what we do is really, really important. And I just wanted to flag, if you aren't a member of the Smoke Free Action Coalition, how important it is to join the Smoke Free Action Coalition. You will get not bombarded, but really timely, useful email updates from Ash and things. And it was just to say there's a very clear evidence-based approach to advocacy, and I think that's really helpful for other areas that we grapple with. So particularly as Director of Balance now and alcohol, this kind of recipe approach, and I mean, where we are on alcohol is probably where we were on tobacco in the 1980s, but it was just to say I do think there's some really useful principles there as such. So just purpose. So the purpose, I think, absolutely it is reinforcing when any time we're with anybody decision making about the uniquely lethal nature of this product. And you know, that was last week, there was so much media to be undertaken, and I was being interviewed on a particular news channel by somebody who wasn't really very supportive around the bill and was arguing what next, but it was like reminding them there was nothing like the cigarette in that sense. The partnerships, so you know, I've already laboured that point, but I think this has to be an absolutely true partnership. But, you know, being well led as well, and having, you know, that autonomy to be able to respond and to act, and to be able to, you know, you've got that mandate to speak on behalf of communities in Cheshire and Merseyside. And, for example, being able to put out a press release without having to go through 10 rounds of sign-off. I can't stress enough that responsiveness is really important. And having somebody that is able to be, you know, distributive leadership, but that figurehead, so that the media can really know who they can come and talk to. The principles, you know, about following the evidence base, absolutely. The principles of that, and the importance for us is the empathy. So all of us knowing that smoking is largely a childhood addiction. So that's been really important, that throughout this whole journey we've been able to really advocate on behalf of people who got addicted and working with them, and the principles of working with our real people as such. The politics, so the sense of this is about building up cross-party support. I think between all of us we've done a great job with that. And I think, you know, this again is a really useful principle in terms of other public health priority areas. Persistence. Deborah and Andrea will know better than anybody how much the persistence to keep going in terms of legislation, but also really importantly of keeping hold of your infrastructure during lots of reconfiguration and cuts and things over the years. But I am really proud that we have managed to maintain this and to keep, you know, fresh going all of this time as such. And I think that's largely been because of, you know, the passion of many, many people, our funders. So we're funded by all of our local authorities and our integrated care board in the North East, and that sense of it's the right thing to do. And ultimately, why we're all doing it, and it was so lovely, your story, Councillor Gittins, is around people, isn't it? It's about our loved ones. And I think this is what we must all remember, because none of these people ever thought that they were going to, you know, die from quite often pretty horrific deaths. And that's my dad. My dad got hooked at 11. My dad died when he was 61. And the last 2 years of his life were just really awful because he had COPD. And I think this is really important about their legacy. And this is what we're saying right now is, if you're an adult smoker right now, this bill is not to say you have to stop smoking or making you stop smoking. If you want to continue to smoke, that's okay. But this is about these people, loved ones, grandchildren, future grandchildren. Why on earth in 2024 would we think it's acceptable to think that we're going to allow our young ones to get hooked onto something and guarantee that they're going to die from something like lung cancer or COPD? And it is, you know, when we said last week in the media, there was nothing like this. This is 26% of all deaths in the last 50 years. So if we can get this through, it would arguably, I think, be the single greatest thing that we can do to impact, particularly around cancer, and all of the strain on the NHS, but also other things like COPD, heart disease, and really importantly, dementia as well. So I hope that's given you a sense of what we do. We genuinely can't wait to work with you, and I so thank you so much. Thank you.